you so much for joining me this evening for this webinar. Tonight, I'm going to talk about mastering medical weight loss with a focus on GLP-1 medications such as semaglutide and tirzepatide. All right, my name is Amy Hoffman, and I've been a nurse practitioner here at Serenity Healthcare Center for over 9 years. And I've really become passionate about medical weight loss and weight loss in general and helping people get to be healthy and feel great about themselves. So there are some new technologies in medical weight loss, and we're going to talk about specifically some of the medications that have been the rage lately these days, the GLP-1 medications, and hopefully we'll get you guys excited about this stuff tonight. We're also going to chat about some other modalities that we have, some med spa technologies that we have that can help aid in that process and help you look and feel your best. All right, well, first we just want to talk about the obesity epidemic. 19 states in the US have an obesity rate that exceeds 35% of their total populations. This is going to have some major health consequences. Obesity is the #1 cause of preventable death in the United States. In functional medicine, our goal is to address the root cause of your health issues, finding out why a person is obese. Is it more than just lifestyle and diet, or is there something underlying going on, like maybe a hormone imbalance, thyroid imbalance, issues with insulin resistance, other illnesses that could be affecting the weight. So what happens if I don't lose weight? There's a lot of different things that can occur with obesity. We have cardiovascular disease, Alzheimer's disease, which we think, is more of a type 3 diabetes, where the diabetes affects the brain, dementia, cancers, rapid aging, joint replacement needs, kidney disease, and high blood pressure. So, for example, we have 65% increase in likelihood of developing Alzheimer's disease in someone that is obese compared to the general population. This is an alarming situation. So we want to make sure that we are taking control of our metabolic syndrome, taking control and getting better control of our insulin levels, of our blood sugar levels, and GLP-1s are a great way to help us do that. So GLP-1 is a hormone produced. It stands for glucagon-like peptide-1 agonist. It's a hormone produced in the GLP-1 is a hormone produced in the gut and released in response to food. So it causes decrease in appetite and the release of insulin. So what is insulin resistance? Insulin resistance occurs when your body's cells become less responsive to insulin, a hormone that's going to help regulate your blood sugar. So when this happens, your body needs more insulin to keep your blood sugar levels stable, which can lead to weight gain and other health issues. By improving insulin sensitivity, GLP-1 helps your body manage blood sugar more effectively, supporting your weight loss and overall health. So the GLP-1 peptides help with liver function, brain inflammation, insulin regulation, heart disease, as well as kidney function. So looking at all the different system benefits here. It's going to have major metabolic benefits as well. They're going to improve insulin sensitivity, particularly in the fat tissue, which helps prevent a cascade of a metabolic dysfunction. This can be very critical when trying to prevent conditions such as type 2 diabetes. It's going to help with appetite control and weight loss. They're going to regulate the appetite, make it easier to control your food intake. You're not feeling as hungry. That's going to lead to a gradual weight loss. And even when used at lower doses, which is known as microdosing, that can still happen. Microdosing, however, does work better in those that are already metabolically optimized. So we usually need to use the regular pharmaceutical size doses for those that are in real need of getting better control of things. It's going to also offer neuroprotection. Originally, these drugs were developed and studied for Alzheimer's and Parkinson's. They're going to offer neuroprotective benefits supporting brain health. They're going to reduce systemic inflammation. They're going to calm down metabolic and cardiac dysfunction. They can also reduce systemic inflammation, improving joint health and overall well-being, and just making you feel less inflamed. So how are the GLP-1s going to help with insulin resistance? They're going to enhance the insulin sensitivity. They do this in fat tissue, preventing insulin resistance that can lead to metabolic dysfunction and inflammation. They're going to reduce appetite, supporting the weight loss. They're going to help regulate the appetite. You're going to decrease your caloric intake without having drastic side effects or feeling hungry all the time. And this can even happen with microdosing. They're also going to reduce systemic inflammation. They calm down inflammation in the body, including the brain and heart, which is going to lead to improved metabolic health, also reduce chronic conditions, reduce some brain inflammation, improve things like brain fog and headaches and fatigue. They also, there's a couple different ways they're going to decrease inflammation. They just in general have an anti-inflammatory effect, but also by losing weight, those fat cells in our body contain toxins and can create inflammation. So the act of losing those fat cells as well can help further decrease the inflammation in the body. They're going to improve gut health. So they do slow things down in the GI tract, which there are some side effects to that, which we'll get into. But also, it's in general, we normally produce these GLP-1s in the gut. So having a good, consistent, steady amount in the body instead of the ups and downs are going to help improve your overall gut microbiome. They're going to support mitochondrial function. They enhance the mitochondria performance, which those are our little energy cells. Those are our cells that come in and help us get through our day, help us get toxins out of the body, help us be healthy overall, and help our immune system. So it's directly helping that mitochondrial function. They're also going to help with those neuroprotective effects, bringing down that insulin resistance. It's going to, like I said earlier, they were developed for neurodegenerative diseases. So they're going to help improve that brain health. And that's going to also lead to metabolic optimization. They're also going to balance hormones. By improving your hormonal regulation, they help address metabolic diseases such as PCOS, polycystic ovarian syndrome, high blood pressure, and heart disease. So all of these things working together can help with that insulin resistance. So we have some clarification about myths and misconceptions surrounding the GLP-1 agonists. They're going to help all your systems, as we talked about earlier. So some common misconceptions. One is that they're only for weight loss. Depending on which medication you're doing, they work really well for decreasing type 2 diabetes as well as weight loss, but they're going to offer those broader effects on the body, insulin sensitivity, decreased inflammation, neuroprotection, as we talked about earlier. Another common misconception is that microdosing is going to lead to immediate weight loss. There certainly are benefits to microdosing. However, when we're trying to lose a significant amount of weight, you really don't want to start out with microdosing. We want to do what we consider more of the traditional pharmaceutical size doses. And then once that weight is lost, microdosing is definitely beneficial for improved metabolic health after that initial weight loss. Doctors fully understand microdosing, which is not true. Microdosing doesn't mean just using the lowest starting dose of the peptides. It's actually using fraction of doses. Again, the baseline dose is the lowest dose that you can prescribe in the brand name world, the pharmaceutical world. We can't prescribe microdoses of those pens, but we can do prescriptions for compounded peptides that can be at even lower doses than the initial starting dose. GLP-1s are a quick fix. That is not true. It's not a one-stop solution. It's not this shouldn't be the only tool in your toolbox. It's a great tool to incorporate with a lot of the other knowledge and other things that we have available to us to use for managing not only blood sugar, but helping with weight loss. So you have to have a really comprehensive approach. You can't use them if you have GI issues. That's not true. You know, it really depends on the extent of the GI issues that you're having. We wouldn't want to use it in someone that has a history of gastroparesis. That is a very small possibility that that could occur because the way these drugs work is they do slow down gastric motility. That's how you're going to feel fuller longer. You're not going to feel hungry. Things just aren't moving through you as fast. So we don't want to make that worse or add to that for someone that has already an issue with moving things slowly through the body. We don't want to use in someone that has active pancreatitis or chronic pancreatitis. Gallbladder, we do have to be a little bit careful with, but if there's gallbladder issues, it just depends on the extent. So it's something that we can certainly talk about, and everyone responds differently to these medications. Some don't really have a lot of GI side effects from them, and some do. And so that's part of the reason why we start the dosing lower and it's a graduated scale, because we do want your body to get used to the medication. We want to see if there are a lot of side effects. That helps us know what we're going to do next for dosing, or if this maybe isn't the right medication for you. GLP-1s work the same for everyone. Again, not true. Individual metabolic health is going to greatly impact the effectiveness of these drugs. People who are metabolically compromised, they're going to require different strategies compared to those that are already in good metabolic condition and already have those good habits also in place. Higher doses are more effective. Many assume that you're going to get better results as you keep going up on the dosing scale. That's not true. What we just want to see is we want to see if the dose that you're at is causing about a third reduction in eating. We don't really want to see much more than that. We don't want to completely take away the appetite. We want you to be able to eat. We want you to be able to get those good, healthy foods, that protein, those nutrients. That's really important. So we don't want to completely eliminate that appetite. So doing those high doses might not be the right choice if it's really not allowing you to eat the things that you need to stay healthy. GLP-1s are a long-term solution for everyone. Some believe that they can be used indefinitely for weight loss or metabolic management. While they can be very beneficial, they should be, again, a part of this broader picture, part of a more comprehensive plan. And when we're talking about using them indefinitely, for weight loss, not for diabetes, that's different. But for weight loss, then we can start introducing the topic of microdosing at that point when you're more metabolically sound, goal weights are achieved, you're feeling healthy. That is something that can be a discussion. All side effects are unavoidable. There's a misconception that nausea, fatigue, digestive issues, they're inevitable. They're just going to happen, so deal with it. They're usually have something to do with maybe the dosing is too high. The body hasn't had time to adjust, or there's been a change recently in the dosing. So we can certainly follow the graduated scale dosing of the GLP-1s. However, we can also personalize it and do in-between doses and adjust things if needed. If starting at, let's take tirzepatide, for example, starting at 2.5 for one person, we may not want to start that on everybody. We might want to start at half of that, just depending on a person's personal history and if they have those side effects in general. Normally, there's a lot of different factors to consider. GLP-1s fix all metabolic problems. Again, you know, some of these medications, as you know, seeing them as a cure-all for metabolic dysfunction, they do greatly help, but they're not going to necessarily fix all your problems. They do work best when you're combining them with your healthy lifestyle choices, proper nutrition, strength training, exercise, hormone balancing. We want to use it as a part of a comprehensive health plan for you. Okay, so we do have a recent cardiovascular approval for Wegovy. Wegovy is semaglutide. It's a brand name for semaglutide. So that was approved in March of 2024. They expanded the use. So Wegovy is approved for weight loss. They expanded it to help reduce the risk of serious cardiovascular events such as heart attacks, strokes, and cardiovascular death. This approval applies to adults who have cardiovascular disease and are overweight or obese. The clinical trials results, the decision was based on what's called the SELECT trial. They had over 17,000 participants, and it showed that Wegovy reduced the risk of major adverse cardiovascular events by 20% when compared to placebo, showing significant reductions in heart attack and stroke risks, which is great. So it has a great public health impact, significant advancement in the treatment of cardiovascular disease, especially considering is such a high prevalence of obesity in our US population, as we discussed earlier in the presentation. And so this is a great option for those that have cardiovascular risk as well. So we want to, as always, use it in conjunction with reduced calorie, reduced fat, and other healthy lifestyle choices. So the two main GLP-1s that we utilize in our clinic, and what we're talking about this evening, are semaglutide and tirzepatide. Semaglutide is a GLP-1 receptor agonist. It's going to mimic the GLP-1 hormone. It's going to increase insulin secretion, slow down gastric emptying, and reduce appetite. Tirzepatide is a dual glucose-dependent insulinotropic polypeptide and a GLP-1 receptor agonist. So not only activates that GLP-1 receptors, but also the GIP receptors. That's going to further enhance the insulin release and appetite suppression. So the dual action is believed to contribute to better weight loss and better glycemic control. In clinical trials, the tirzepatide showed more significant weight loss and better glycemic control compared to semaglutide. Some studies showed up to 22.5% weight reduction in those on the highest dose of tirzepatide. And the semaglutide is also highly effective for both weight loss and diabetes. The weight reduction in those studies was about 15%, so a bit less potent compared to the tirzepatide. They both were great. The approval for usage, it really depends on the brand. So semaglutide is available under Ozempic, which is approved for diabetes, and Wegovy, which is approved for obesity. So, it's the same peptide, same exact peptide. One company, one brand is being approved for one thing, the other is being approved for the other. Tirzepatide commercially is available as Mounjaro, which is approved for type 2 diabetes. Same peptide, tirzepatide is also known as Zepbound, is approved for obesity. So semaglutide common side effects: nausea, vomiting, diarrhea, abdominal discomfort. Similar side effects for the tirzepatide. However, tirzepatide generally has less reports of these side effects. It's generally a better tolerated medication. So we usually see a lot less of those side effects. Both are administered as a once weekly injection, a subcutaneous injection. It's a really tiny needle, but we can adjust that if needed, depending on a patient's condition and their treatment goals. So in summary, the tirzepatide is going to be a more potent with that dual action, leading to greater weight loss potential and less side effects compared to the semaglutide. Again, everyone responds differently to these peptides, and so semaglutide might be completely fine for some. Okay, so GLP-1, who are they good for? A lot of people. Postmenopausal women, metabolic or insulin resistance, those with sedentary lifestyle, BMI of 30 or higher, or approved for BMI of 27 or higher with any other conditions like high cholesterol, hypertension, type 2 diabetes, those with cardiovascular disease, as we talked about, those that have a risk for Alzheimer's, dementia, those with chronic pain or inflammation, kidney disease, liver disease. It actually helps improve fatty liver, and it actually helps improve kidney function. And anyone that really wants to optimize metabolic health. So in summary, most people, who's going to avoid those that have a personal or family history of medullary or B-cell thyroid cancer. There have been rat studies that did show some of the rats developed that medullary thyroid cancer. So the risk is very, very low. We have not seen it translate to humans. Peptides have been around for a while now. Lots of people are using them. So we haven't really seen reports of that in humans, but it was observed in rat studies. Therefore, it is on the label as a black box warning. So those I mentioned earlier with gastroparesis. You really don't want to use these. It could slow things down further. We don't want to cause any blockage in the GI tract, requiring something more serious like a surgical intervention being needed. Those with significant constipation or history of bowel obstruction, again, we don't want to induce anything that's going to make those things worse, creating the potential for a more serious intervention like a surgery. We do want to use in caution for those with significant bowel surgeries. So, we do usually like to clear things with a GI or gastrointestinal surgeon if there's been one involved, if there's been a significant bowel surgery that's happened. All right, so we want to talk about just one success story. We actually had quite a few. We have Carrie who struggled with weight gain around her midsection, most notably, a problem she really didn't face before menopause. She also notably had some mold exposure, so she had some inflammation from that, was ill from that. Frustrated and eager for change, she decided to try the GLP-1 therapy. About 3 months, it took her to lose about 20 pounds, reduced her waist size by about 4 inches. And last time we spoke with her, she was about 4 pounds away from her goal weight. So she's happier, she's more energized, and losing weight also is a great motivator for continuing to lose weight. So we do want to talk about a comprehensive treatment approach, holistic care combining technology, medicine, and lifestyle adjustments, also a long-term health focus. Importance of maintaining your muscle mass and your functional health. So there are other things that we probably do want to look at as you go through this process. All right. So we talk about weight loss clinics versus integrative clinics. There are a lot of weight loss clinics that have kind of popped up. They're on the internet. We are considered an integrative clinic. So what that means is we want to tailor your experience, tailor your treatment to you, and determine what else needs to be discovered or worked on in your health versus just giving you the medication, throwing you on your way, upping the dose the next month. We do want to figure out, okay, how did you get this way? How did you become metabolically unstable or have some deficiencies, have some insulin resistance? We want to figure that part out. All right. So, really to try and make sure you're successful, make sure you're tolerating the medications. We take into account the most common side effects that you're having: nausea, constipation, headaches, decreased appetite, muscle loss. I know that potentially that a lot of those side effects can be dose dependent, so adjusting the dose can be really helpful. We want to focus on low dosing, meaning we don't necessarily need to up the dose just because it's the next month and you're due. If you're having good appetite suppression, you're tolerating it, you're slowly having some weight loss, then that's a good dose for you. We don't need to necessarily increase it. By increasing it, then we up the risk of having more side effects. We want to make sure you're having good fiber, magnesium, water, eat healthy foods, focus on the nutrient dense foods, your vegetables. You want to make sure you're getting enough protein. That is really important. Weight-bearing exercise. We don't want you to lose that muscle mass. Any weight loss program, you're going to see potentially a loss in muscle mass. So it's not exclusive to the GLP-1s. There are people losing a lot of weight really quickly. And so there is discussion out there on you're going to lose all this muscle mass. And then when you come off of it, you're going to gain all the weight back. And then you're worse off because you don't have that muscle that you had before. That's true, actually. So what we want to do, but that's true of any weight loss, any quick weight loss, not exclusive to the GLP-1s. So what we want to do is make sure you're incorporating a strength training regimen. We can monitor your skeletal muscle mass. We can monitor your body fat percentage and your water and make sure that things are becoming balanced. And then we do have some things that we can incorporate in our clinic that are going to help restore muscle, restore tone, help with that skin elasticity. All right, lean muscle mass and cellulite are, again, like I said, real concerns. So what we want to do is implement some strategies to combat that. So there are things like radiofrequency heat, which targets cellulite, it targets fat, it targets helps with skin tone and texture. We have pulse wave therapy, microneedling, which those needles are going to help further fat loss. The needles go into the fat tissue. It can actually further the fat loss. They also are going to help with collagen and elastin and help that skin turnover, make the skin more youthful. So as we see things kind of sagging after weight loss, that can really help. Combining that with the muscle building as well. Here is something called Evolve. So we have electro pulse therapy combined with radiofrequency heat. So it's providing a radiofrequency heat and a muscle contraction at the same time. So it's like getting a really intense, really great workout. We just apply the pedals to you and you can just lay there and relax and have a really great workout. And you can see here, this is an example of a before and after of toning that, getting rid of some of that fat to the back tissue where it's kind of sagging down after weight loss, and kind of toning that up. Here's an example of an abdominal workout using the Evolve treatment. Again, it's muscle contraction and radiofrequency heat, that pulse wave. And you can see the difference in the muscle tone here. We have all heard of Ozempic face. So that is that kind of gaunt, saggy appearance that can happen when you have a rapid fat loss occurring. What you're going to see then is there's fat and muscle in the face too, that after we lose that fat, it feels less full and things can kind of droop down. So typically when losing 20 to 30% of body fat, that's when we really start to see that sagging, that sunken appearance. So we do have some strategies that we can do to combat this loss. So we want to look at healthy face. We can do something called M-Face, which is using kind of like the Evolve. It's using radiofrequency heat combined with electromagnetic stimulation. So it's contracting the muscles of the face and it's only affecting the elevator muscles of the face. So it lifts and tones the face. So it helps improve that gaunt appearance. It's also going to help reduce the appearance of wrinkles. So it's a great anti-aging tool for anybody, but it also is especially helpful for those that are using the GLP-1s because it's going to make the face look stronger, more chiseled, more full, can help with jowls and help with that saggy appearance. We can also apply it to the submental area, so the area under the chin, and it really can significantly affect and reduce a double chin appearance. So we've seen, again, furthering making this slimmer look under the neck, but there's also that laxity that we can see under the neck, and we're also getting that lifting of the face as well. Okay. So what we want to do is, to recap, is mitigate side effects, reduce muscle wasting, achieve around a 10 to 20% body fat loss over. And when I say that, I mean about over the course of a year, 6 months to a year. And it really depends on what your goals are, what your weight loss goals are, and where you're at when you start. We want to tighten the skin. We want to reduce cellulite. So I would love to talk to you guys about our packages. We have several different packages geared towards either the semaglutide and the tirzepatide. So I want to first start out by saying thank you for attending today's webinar. I really appreciate your time. I'm excited to walk you through our exclusive nurse practitioner and physician supervised weight loss packages that are going to help you transform your appearance and your confidence. So let's start by reviewing the Serenity Slim, and we can talk about the packages that's going to offer you the most value and the fastest results. So we have 4-month packages. We with the Slim Start, we have 4 months of the GLP-1 medication. We have body composition testing to track fat loss and muscle preservation. We have core metabolic testing to to help you understand how you're burning calories daily. We have body measurements. So this package is for semaglutide is valued at $1,700, but for today's webinar, you can get it for $1,360, giving you basically the 4th month free. Tirzepatide, you'll get this package for $1,680. We also have the advanced body makeover, our next tier up. And here's where things get really exciting. So you get the package, this package is ideal. You're getting faster, more dramatic results, and then it's going to include everything in the Serenity Slim program, plus 6 body contouring treatments. That's going to help eliminate cellulite, tone your muscles, tighten your skin. It's going to help you achieve those benefits of weight training in just 20 minutes, and you're not spending any time at the gym. You're also going to get a 2-week individualized meal plan so that you don't have to stress about what to eat. You also learn some great tools to take home and use at home. So if you're serious about getting fit, this is a great package for you. The regular value is $4,900 for semaglutide, $5,200 for the tirzepatide. But for attending the webinar, you're going to get it for $3,220 for the semaglutide, or $3,750 for the tirzepatide, a savings of over $1,600. The next package we have is the Body Slim and Facelift. So if you're ready for the complete total transformation, this is going to include the weight loss with aesthetic enhancements. You're getting everything in the advanced body makeover, plus 4 non-surgical facelift sessions using the M-Face. This is using the latest technology to give you a natural, rejuvenated look without the need for invasive procedure. So it's like a non-surgical facelift. No more worrying about Ozempic face. As you lose your weight, you'll be slimming down and lifting at the same time. For the semaglutide, this one is valued at over $1,150. For the tirzepatide, $12,600. But for today, you're going to get it for $6,420 for the semaglutide and $8,100 for the tirzepatide. We also have the Serenity Ultimate Transform for those that want the complete transformation, body, face, and hair. This package is the one to go with. You're going to get everything in the Body Slim and Facelift package, but we also added TED hair restoration packages to combat hair thinning that can occur with rapid weight loss or post-menopausal changes. So this package is valued over $15,000. For attending today, we have it for semaglutide for $10,275, or for tirzepatide, $10,710. It's a huge value and a huge savings. So if you're serious about really kind of doing that transformation, these are the different packages for you. I highly recommend, if you're wanting to do that total transformation, then do the ultimate transformation package. So, can you afford it? It is a big investment. You're investing in your health, you're investing in your future, you're investing in getting rid of those medications that many of you won't need. We've seen people come off of blood pressure medications. We've seen people come off of diabetes medications. We understand, I understand it's an investment, but you're investing in yourself and your health. So we do offer financing. There is 0% financing available for 12 months. So if you're interested in one of these bigger packages, but you can't afford it all at once, that is certainly an option for you. And then the price is split up over that 12-month period. So if you're ready to take advantage of any of these packages, please reach out. If you guys have any questions, please reach out to me, and we'll give you as for showing up to the webinar, you're gonna get just mention that you saw the webinar, and you'll get the great savings on these different packages. They're not gonna last forever. The deals won't last forever. So please take advantage as soon as you can. All right. Thank you so much for attending, and anything that you guys have questions about, please do not hesitate. Thank you.